Assalamu alaikum. And the purpose of recording this small audio is that I just want to highlight some of the important components which a supervisor should always keep in his or her mind. Because unfortunately, despite FCPS or MS training or MCPS training being recognized in that way, that our degrees are still having some of the appreciation in at least in Saudi Arabia. The rest of the recognitions are uh, um, going away very fast. But still, on the basis of FCPS, like we are getting exemption from press exam of Ireland. PLAB exemption recently finished. On the basis of FCPS, we are still becoming consultant in Saudi Arabia. Rest of the countries are already never getting response. MS and DA and MCPS, out of them, MS, because it is recently introduced in Pakistan maybe a few years ago. Before it was only in some of the hospitals. So, like, still, it's not there in the Saudi Commission registration log in by which they get registration. So, MS unfortunately is not getting any reward. They are maximum registrar. Same is true for MCPS. They will be the maximum registrar. DA is not considered at all. Okay, so this is something very important. Now coming to because this point is very important for the supervisors as a leader to know, because they should be guiding their residents what they should be doing in their career, because career counseling is very important for the resident. The supervisor should be evaluating the personality, the family circumstances, the overall package for that resident, and guiding him what him or her what is the best for that particular resident. Unfortunately, it doesn't happen. Unfortunately, uh, of course, my message is for majority of the people. There will be some exceptions still in Pakistan where the supervisors are uh, doing their duties perfectly, but unfortunately, majority of the supervisors, they are not realizing their role as a supervisor. They should be punctual, they should be dedicated, there should be some involvement from them. They are never in the operation theater. I'm talking, of course, I'm talking about anesthesia. 99% of supervisors, they never go to observe the resident firsthand in the operation theater. They are always busy in administration, and they have this excuse always that they are busy. They have, especially if they are professors, they are very busy in meetings and this and that. But still, they have to find out some time by hook or by crook, because this is their responsibility. Because when I say this thing to some few of our supervisors, they say that people don't want to become supervisor, and we have to tolerate them, and we cannot ask them, we cannot have any accountability for them. Unfortunately, that is the reason why our all of the system in Pakistan does not improve, because we are not ready to invest something which will bring the result after a few years. There is no way, if someone is enjoying a position of a professor, of associate professor, assistant professor, they cannot say that they are not willing to become a supervisor. There should be this. It is mandatory. How can they become with the label of assistant professor, enjoy the stuff which is there, and they are not interested in teaching? No, this is not at all. And there should be a ranking. I have spread this message loud and clear, but unfortunately, it will never happen, because how can they dig problems for themselves? There should be evaluation system by the residents for the supervisors. There should be evaluation system by on the basis of their candidates passing in first attempt or second attempt or third attempt, and should be there on the website, that whosoever is choosing any supervisor, he or she should know the what sort of supervisor I am getting. Because unfortunately, this is never organized. It can happen. There is no way CPSP say that we cannot do this thing. This is very much possible. There should be a rating system, everyone know, and then when it will be evident on the on the website, everyone will be worried about it. That if someone has a big name as a professor and their rating is terrible, that their residents are not getting exam in first attempt or second attempt or not passing at all, there should be a system. Unfortunately, we don't have a system, and we don't want to change the system because like I have no words. Unfortunately, I'm very sad to say this thing, but this is a reality. Unfortunately, we are not having people who want to change this system really. Okay, this is one thing. With reference to what they can do, they should have dedicated time for the residents to be observed with their eyes with reference to technical skills, like with reference to performance of spinal anesthesia, epidural anesthesia, or any procedure, intubation, fiber optic, any block, etc., etc. And first thing is that even I have seen number of people who have become supervisors, who have passed their exam, does not know how to paint the patient. They are not clear in their technique. So why? Because they got the skills observed by the people who are not interested. I like usually in our government hospitals there will be a medical officer who's not in training program, and he's the immediate teacher, unfortunately, in many of the hospitals. And this is a reality. What will he get from that person? Unfortunately, not nothing. So this is very important that they should observe, and they should make sure that the resident knows about this thing, that he or she is being observed all the time, at least for few cases, not 99% times they are not being observed. So majority of our supervisors never go inside the OR. How can they get the feedback? How can they observe? And they are only relying on the feedback of some of their seniors. Maybe they are not themselves involved, and this is the reason the performance of residents is never being checked. So this is very important. They have to give the first hand, they have to get the first hand information about the resident from the colleagues, from the staff, even paramedical staff, and they should give corrective messages that they should improve it. Communication skills is one of the most important thing. The resident does not know how to communicate with the patient, how to communicate with the different specialities, how to communicate with the relatives of the patient, and how to present their case in front of other specialities or in front during the rounds, during, like if they are calling their senior about that case, they don't know how to give the correct information. Their presentation is very haphazard because unfortunately they are not being corrected there during their training, and they learn those skills and they remain like that forever. So this is very, very important. Then it's very important thing is that they should tell them how to study and what to study. Usually if they are being asked by their residents what to study, they will say, please read Morgan, and they don't know what they should read. There are so many things, because anesthesia specialty is not like getting the information about a case, about a disease, about the equipment, about the complications in one book. There is no perfect book for anesthesia up till now. There is no book which will give them a perfect concept, because they are doing the cases, and there is very few of the books which are covering all the aspects with reference to complications, with reference to equipment, with reference to diseases, with reference to different surgeries, their things to do. Like for example, if the patient is having a case of laparoscopic cholecystectomy and with comorbidities, how will he correlate? The problem is that he will be reading from this terrible book, Morgan. He will have no concept. So in 2023, world has totally changed. All the review articles which were not available before, they are available. They are available. They are available with the reference to access. It's like it's not at all a number of people like me. I have dedicated the link for everyone. I have the subscriptions. I downloaded and I have arranged them in in the topic wise as well as year wise. It is for everyone. You can use it. It's for everyone to get it. There is no problem. Or for example, they have to get some more subscription, they should do it. They can create funds from with reference to pharmaceutical companies, for from which they are having very good big conferences. They are sponsoring them. There are parties going on with it. But unfortunately, the things which are important, there should be a big library with research articles, with review articles, with the latest books, and any helping material, which is mandatory for developing of their skills with reference to ultrasound machine, bronchoscope, or anything which is mandatory. I know that a few of the hospitals will have these facilities, but majority they don't have. And the role of Pakistan Society of Anesthesia is nothing more than having parties and celebrations with reference to conferences. Nothing else is being done which is important for the training of the residents. And what can I say? Like if they just invest the budget which they collect for one anesthesia conference, they can have a very highly developed skill lab for their residents, where any resident can come and learn ultrasound and other things which are very important. Okay, so this thing should be thought about it, and we should be meaningful rather than only busy in arranging the conferences. There should be something which is more important than arranging these conferences. So target oriented study and development of these things are very important for the residents. Then very important thing which unfortunately is not there is with reference to proper rotation and logbook. Like they are usually having, for example, there are institute in Pakistan which are only for cardiac, or renal, or like kidney hospitals, or only having cardiovascular diseases. How can they have FCPS resident for 4 years, though their training, their rotation is only for maybe 6 months? And they are inviting people to have 4 years training with on paper rotations into the different hospitals. But unfortunately, if they follow the proper rotation, those residents will be there only for 6 months, and 42 months they should not be there. So there is there is no fun in getting those institutes registered for 4 years training. Please have mercy. How can someone recognize these institute for full FCPS anesthesia training? It may be true for some of the specialities, but it is not true for anesthesia. The rotations which I did not had in my during rotations, I couldn't do, and I learned them quite late when I was working in different hospitals where those rotations or those cases were there, and I had to learn when after my finishing my exam. But if, for example, I were in a cardiac hospital, what would I have learned in that hospital other than cardiac? Unfortunately, this has to be taken very seriously. Our hospitals does not have proper rotations, unfortunately. There are people who will be working in one specialty or other specialty, and they never ever have proper rotations and proper logbook. It is a responsibility of the supervisor to make sure how many procedures that resident has done, how many cases that resident has done. It is only that at the end of the day, they are just sending. Before it was paper, now it is online, and we are very happy that we have made it in online. And the resident is sometimes having the password of the supervisor's account, and they are accepting it. This is what is happening, unfortunately. So there should be serious step to fill the gaps in these problems. Then the supervisor, there is no way the supervisor does not know about the international challenges, the international guidelines, international changes which are occurring every day, with reference to different specialities of anesthesia. And there should be proper information about the exams, which our resident can appear, and individualized career counseling, what they want in their life, what they want to do. They want to work in a THQ hospital after passing their exam, or they want to go to Saudi Arabia, or they want to go to UK, or they want to learn whatever they this is the duty of the supervisor to get the information from the world, because he or she has more experience, more exposure, and there is no way that he is just putting everything on the resident, that he will himself or herself struggle and find out some way. This is the reason why our Pakistan system does not improve, because we have people like that who have the thrones of supervisor, and they are running the show. Unfortunately, they don't deserve to be on the place of being a supervisor or a teacher. I have no personal interest. I have no personal conflict of interest. I am not in system of Pakistan, and I don't have, like, because a number of people who just happen to listen these things, they will be angry at me. But I don't have any personal interest, and my these words are only for the residents who are struggling in our pathetic system. Okay, and this system does not change, because we are very happy in saying all is well. We are very happy that we just tap each other, congratulate each other, have pictures posted on Facebook. Our result is 100%, IMM result is 100%, cake cutting ceremonies, and that's it. We think that we have fulfilled our duty. This is not the way. Unfortunately, this is not the way. The CPSP should take some steps for this thing. And the currently the system which they have done of all MCQs is heading towards a disaster. Our people, they don't have the capability of making MCQs cool, which is good enough for all covering all those candidates who are appearing in different exams, MCPS, FCPS, IMM. It needs a lot of investment. Making MCQ is not an easy job. Is not an easy job. And I don't know who were the brains which who decide this thing, to have 100% MCQs in our exam. The exemptions are getting away from us, and they will vanish. The only exemption which we have at the moment is the Irish Medical Council exemption, and College of Anesthetists primary exam. And I'm 100% sure, if they come to know that they have changed the system and we don't have SAQs now, only MCQs pattern is a disaster. It has so much flaws. Yes, if the pattern which was combined with MCQs and SAQs, there was a margin that the people who don't have the concept, they will stuck either in MCQs or they will stuck in SAQs. Unfortunately, they change it without any deep insight, and only because of few minds they change the pattern. And now our residents, they are very happy to have half cut terrible MCQs pool. They just read them, and because out of 200, 150 MCQs are being repeated. Can you believe this? I became so much shocked when I get this information from the residents, that, sir, what we should read, because the paper in the exam, there will be 150 recall questions out of 200. So what we are giving, please have mercy on our system. We are only already, as a country, we are in trouble, and these steps will make more disaster, because the people who have taken this step, they have already passed through their careers, and they are not foreseeing what will happen because of this thing. We don't have any work based assessment, as I told you. There is no work based assessment in Pakistan, and this is the reason the people, only few residents who get a chance to have their skills improved by one way or other, they do it by themselves, and then they are their brains are very good. That's why some of them, they are able to bypass these flaws, and still they are very good in their clinical practice. But I'm talking about individual. Talking about people who are getting trained even in cities like Hyderabad or DG Khan, or any other hospital far flung, where they are getting the training recognized and they are doing the training. Unfortunately, what we are doing, why we cannot have accountability of the supervisors, why we cannot ask them, why we just treat them as a holy cow. Why? This is their responsibility. They have to fulfill their requirements, and the few of the people who are doing it, I say salute to them, because in this system, if they are surviving, and if they are doing this, this is a big blessing for their residents. But unfortunately, it is not happening. So take my words as positive. This is not for for insult of any person individual. And it is for I love for me, my hero is first year resident. My hero is the person who is just entering in the system, and he or she has to survive in this system. So please, all of my senior colleagues, I humbly request you to have a look, think that when they are signing the paper of becoming a supervisor, they should think they are taking the responsibility like parents, and they have to fulfill the requirement. There is no shortcut, either for the residents and either for the supervisors. If they think they will just have cake cut ceremony and pictures posted on Facebook and their responsibility is finished, or they are having an exam course finished every before every exam, this is not the replacement of physical presence of the supervisors with the residents all the time, or at least some of the time every week or every month or sometime in their rotations for that speciality. We unfortunately we are not doing it, and all the time we have only explanation. We have our circumstances and we have to live with it. Yes, we have our circumstances, but still, even the thing which we can do, unfortunately we are not doing it, and we don't have any answers. Thank you very much.